Multiple sclerosis is a very debilitating and devastating disease. 400,000 Americans and 2.1 million people worldwide suffer with MS. It is not curable and the cause is unknown, but there are various treatment options that either slow the progression of the disease or help with the symptoms. The disease not only interferes with physical wellness, but can also harm the sufferer's relationships. MS is very important to me because a close friend of my family was diagnosed in late 2007. Working in a nursing home has shown me the long-term effects MS can have on a person. The nervous system is made of cells called neurons. They have long axons which electrical signals are carried down. The axons are wrapped in a myelin sheath, a fatty coating that makes electrical impulses travel faster. This is what a neuron looks like, usually, and this is the axon where the myelin sheath covers. The body's immune system attacks the myelin, causing the neuron to scar. The signals then become distorted, slowed, or blocked. There are four courses the disease can take. The first disease course is called relapsing remitting MS. This type is characterized by defined attacks of worsening symptoms with relapses followed by remissions. 85% of multiple sclerosis sufferers are initially diagnosed with this type. The second type of MS is primary progressive. The type is characterized by worsening neurologic function with no relapses or remissions. Only 10% are diagnosed with this type. The third kind of MS is called secondary progressive. This type is developed in people who have already dealt with relapsing remitting MS. The disease progresses slowly without relapses or flare-ups. 50% of people diagnosed with relapsing remitting develop this form of MS within 10 years of diagnosis. The last kind of MS is the rarest. 5% of people are diagnosed with progressing relapsing MS. It steadily worsens from the beginning with no attacks and no remissions. The symptoms of MS vary depending on what neurons are affected and what stage of the disease the person is in. If the neurons that send messages are affected, motor symptoms will occur, and if the neurons that receive messages are affected, problems with sensation will occur. Common symptoms of early MS are numbness in the limbs, tingling, weakness in the limbs, loss of balance, blurred or double vision, or pain during eye movement called neuritis. Some less common symptoms are slurred speech, diminished coordination, sudden paralysis, or cognitive problems. Some symptoms of late MS are difficulty walking, fatigue, heat sensitivity, tremors, muscle spasms, dizziness or vertigo, speech and swallowing problems, impaired thinking, and vision problems. About half of people with MS have cognitive impairment and is the leading cause of disability in people that have MS. There are three types of MS symptoms: primary, secondary, and tertiary. Primary symptoms are a direct result of the deterioration of the myelin. Secondary symptoms result from the primary symptoms, such as pressure ulcers and incontinence. They are treated by preventing the primary symptoms. Tertiary symptoms are problems such as social, vocational, and psychosocial problems as a result of primary and secondary symptoms. The most common tertiary symptom is depression. There is no known cause of multiple sclerosis, but there are some risk factors and geographical and racial correlations. It is thought to be inherited, but cannot be solely dependent on genes, because if one identical twin has MS, the other only has a 30% chance of contracting the disease. 2 to 3 times more women have the disease than men. Measles, herpes, and the flu virus have been linked to MS, but no direct correlation has been proven. Caucasian people are much more likely to get MS, and it is most common in Scotland, Scandinavia, and Northern Europe. Though there is no cure for MS, there are some medications and therapies that can help. Corticosteroids are the most common treatment for MS. They reduce inflammation during relapses. Mitoxantrone, also called naventrone, is an immunosuppressant usually used for treating advanced MS. It can be harmful to the heart. Glatiramer, or Copaxone, is believed to block immune system attacks on the myelin. It is injected daily and can sometimes cause flushing or shortness of breath. Interferons are also used to treat people with multiple sclerosis. They slow the progression and worsening of symptoms but can cause liver damage. In addition to medications, physical and occupational therapy can help people learn how to make their daily tasks easier. For people that do not respond well to steroids and are experiencing severe symptoms, plasma exchange is an option. Living and coping with MS can be extremely difficult. For many people, support groups and counseling help tremendously. Later in life, assisted living may be necessary, but there are things sufferers can do to help manage their symptoms. Moderate aerobic exercise improves health, stamina, and mood, and can also help manage certain symptoms, such as fatigue, bladder and bowel difficulties, and weakness. A good diet, low in fat and high in fiber, has been shown to help with managing symptoms. Because of the debilitating nature of multiple sclerosis, sometimes people cannot work, and that can pose major financial problems. About 25 to 30% of people with MS have Medicare, and many also file private disability claims. Even though the cause is unknown and there is no cure, there is something we can do to help. The National MS Society hosts many Bike MS and Walk MS events every year. If everyone takes action, hopefully we can put an end to this disease.